Are you suffering from severe neck or severe back pain and you're considering spine surgery, but you don't necessarily understand what are the risks and benefits of surgery? Well, in this video, I'm going to walk you through that. I'm Dr. Deepti Jain, and I'm an orthopedic spine surgeon, and I have performed thousands of spine surgeries in my life. And let's go through some of those risks and benefits. So, starting from the top, in general, that is a very big conversation. But taking it a step back, before even thinking about the risks and benefits of surgery, it's important to make sure that your spine surgeon has gotten the diagnosis right. Because we know that there are certain diagnoses that do really well with spine surgery, and then there are certain diagnoses where the outcomes are just more unpredictable. So for example, if you have nerve-related symptoms, if you have nerve pinching and nerve pain, that is a problem and a diagnosis that is much more likely to get better with spine surgery versus someone who doesn't necessarily have nerve-related symptoms or nerve-related pinching, or that doesn't have symptoms of what we call spinal instability or abnormal motion. Not that those patients won't get better, but it might be a little bit more unpredictable. So that really is important in determining what the benefits of surgery are. For many patients, again, depending on the type of surgery performed and the condition, the goal is to improve the patient's symptoms. Most commonly, that symptom is pain. Sometimes those symptoms can also be numbness or weakness. We do know that numbness and weakness don't always reliably get better the way that pain gets better. Doesn't mean it won't get better. The benefit of spine surgery is to improve the quality of life, or at least that's the goal. Now, there are lots and lots of risks about spine surgery, and I do surgery that's very small, that maybe is about 2 inches wide, and I just take the pressure off the nerves. I also do spine fusions that come from, let's say, the top of the back to all the way to the pelvis. And so those are very different spine surgeries with very different risk profiles. And so the risks can often be specific, number one, to the surgery, but then second, also to the patient. A very healthy 25-year-old is going to have probably much lower risk of having a spine surgery than, let's say, a 70-year-old who has a cardiac condition and also has diabetes. That older patient with medical problems is probably at higher risk. In general, the risks of spine surgery include risks to any of the nerves that are in the area, any of the surrounding organs that are in the area, depending on the spine surgery that's being performed, the risk of blood loss, the risk of infection. These are all things that happen anytime we do anything in the body.